Okay, great. Hi, everyone. My name is Hong. I am an investor with the Innovation Fund at the California Healthcare Foundation. So just to start, I'll give you some context about the foundation, and then I'll sort of narrow down into who I am and why I'm here today. So the California Healthcare Foundation is a $750 million endowment. We were converted from when Blue Cross of California converted into a for-profit plan and had to spin out a lot of community benefits from all the tax benefits they received over the years. And so out of the $750 million, we spend about $30 to $40 million each year doing grant work. And our mission is to improve healthcare for the underserved in California. And primarily, we've been very deliberate in focusing on the delivery system. So read that as Medicaid plans, the public hospital systems, the federally qualified healthcare centers. So who are we at the Innovation Fund? We're an odd bird. We're funders. Are we a foundation? Are we investors? We're a lot of things. So what I do as part of the Innovation Fund is we actually go out and look for for-profit venture-backed companies that have interesting solutions in healthcare and help them come into the Medicaid space in California. So how do you think about us? So I would typically say, think about us as a strategic investor. And in this case, our strategics are the Medicaid plans, the public hospital systems, and the clinics. So when we're looking to make investments, we're looking for fit with the company and our different stakeholders. Unlike a strategic investor, instead of our strategics giving us money to invest, we have our own money, we invest in companies, and we actually give our strategics grant money through grants in order to help them implement and adopt the innovations that we've all agreed that would be helpful in their system. And so we also think of ourselves as impact investors, and I feel like certainly not an uncommon concept, especially in this room, and we feel like, there are a number of impact investors that get creative about how they define impact. We are very specific in that we are dedicated to the safety net in California. And for the entrepreneurs in here, I would venture and guess and say that that's not an area that you sort of rush into as a viable market. So one of the things I want to do here today is tell you a little bit more about Medicaid and across the country and in California, and then give some advice on how we see the market and how we invest. And I would also venture to say that many of the other investors on the board who do very healthcare IT and services investing probably see companies through very similar lenses. So first, Medicaid is a massive market. So across the country, it's about 1/5 of the population. And in California, it's 1/3 of the population. And as you can imagine, that's expanded a lot with the ACA over the years. And I'm sure a lot of you felt or heard a lot of hype around Medicare and the opportunities there. And just to throw it out there, not that I have a competitive spirit, but Medicaid is as big of a market, if not larger. So think about that. So also with Medicare, a lot of the interest has been around Medicare Advantage and this movement towards insurers taking risk. In Medicaid, we're actually already there. It's about 80% managed Medicaid in California and pretty much across the country. And this slide is just to say, the managed Medicaid, the risk-bearing populations, is a big cost bucket. It's about 60% of spend in Medicaid overall. And so this leads me to my tip number 1. For any entrepreneurs out there, move towards value. It's not just that it feels like the right thing to do and it's sort of the trend and where the market's going, but it's also really hard. And because it's really hard, it makes it a differentiator for you. And that's what we're looking for as investors. And particularly to move towards value, you really have to have good data and analytics because you are moving away from the individual care as they present themselves to prediction to population. So more about the Medicaid market. Maybe not so expectedly, Medicaid patients are typically are more complex, have more chronic conditions and poor mental health. Much like the other markets, California, the top 5% of Medicaid patients account for most of the cost, so 50% in California. And that leads me to my tip number 2, which is focus on populations with complex needs. Again, extremely hard, because there's a lot to consider when you try to manage the full population. But here, if you're being more focused, you can be a lot more deliberate about which patients and still remember that we're still talking about big dollars at the end of the day per patient. And so Medicaid patients receive care very differently. Typically, they receive it in the community, at these community clinics, as opposed to the doctor's offices or as part of large hospital systems. And so as a result, most of the care delivered through primary care. And then you can see here, there's a discrepancy between what specialty physicians, how many of them actually accept Medicaid patients versus any other ones like Medicare. And so for us, that creates a significant shortage in the specialty provider realm. And that, as you can imagine, leads to difficulty obtaining referrals to specialists, and then sort of as the overall trend of physicians aging out of the workforce, the whole country, and particularly in Medicaid, we're seeing a significant crunch on the workforce. So tip number 3 is focus on your workforce. It's a hard thing to do, again, also a differentiator if you can get this right. And at the end of the day, this is about scalability and scaling your model, and the majority of healthcare costs are going to the workforce to begin with. So in summary, these are the things that we are typically looking for when we're looking to invest in companies. Taking the value-based approach, again, it's very hard to do, invest in analytics. That is going to be a very key differentiator. 2, focus on populations with high needs. You can be a lot more deliberate about what those interventions are, actually being able to make an impact and demonstrating that to buyers that do exist, that are incentivized to actually care about these populations. And then 3, scale the workforce. I talk about here in terms of telemedicine, obviously that's a very significant component of it. Data is another one, understanding triaging of which patients should be receiving care when. And one I didn't mention up here is care extenders or redesigning the care team. Another thing I'd like to say is there were some questions earlier about how do you implement this in the workflow. Providers have so many other priorities. It's very difficult to change. I would say as a business, don't be shy about adding services. I think, so I would call myself a healthcare IT and services investor, and I think there's these categories of different types of investors. Those like me realize that there are extremely few, if any, pure IT healthcare companies. Inherently in the business model, you just have to add some professional services or take up as much of the value chain as possible so that you can control the quality. So don't be afraid to add a navigator, a case manager as part of your business model, and feeling like that takes away from your ability to scale. And so we practice what we preach. This is our portfolio that we are very proud of. We have some very deep companies around the care model, very deep in analytics, and doing a lot around telemedicine more broadly. And that's it. Thank you.